Good afternoon, and welcome to this presentation on trauma-responsive parenting coordination. I am Amanda Wall, and thank you for being here with me today. This is my contact information. I am a family law attorney in Tallahassee, Florida, and I'm of counsel to the firm Fournier Law. I'm also a Supreme Court certified family law mediator and a parenting coordinator and a guardian ad litem. I was also a family law magistrate for the Second Judicial Circuit here in Tallahassee and the surrounding 6 counties for 6 years. In all of my different hats that I have worn in family law, one of the primary topics in all of my work has been being aware of the trauma my clients have experienced in their life and being aware of the trauma the children in the family that I'm dealing with have experienced and how that affects my case with the client and what I can do to help that client, the children, and their family. So 2 topics today in this presentation on becoming trauma informed are first trauma awareness, and then second, the second section will be on trauma responsiveness, what you can do to be responsive to trauma in your cases. So let's first begin with how you become trauma aware. Dr. Nadine Burke-Harris is an expert in the field of trauma awareness and trauma responsiveness. She is a Harvard graduate, a physician and pediatrician who was the Surgeon General of California from 2019 to 2022. And she is an expert in the link between adverse childhood experiences and toxic stress to negative health outcomes throughout a person's life. I have a short video from Dr. Burke-Harris. It's on YouTube. This is an excerpt from the full TED Talk that you can find on YouTube. I would suggest watching the entire talk. It's just terrific. And Dr. Burke-Harris is really an incredible speaker. So let me put that on for you now.
In the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or packaging chemical. It's childhood trauma. Okay, what kind of trauma am I talking about here? I'm not talking about failing a test or losing a basketball game. I am talking about threats that are so severe or pervasive that they literally get under our skin and change our physiology. Things like abuse or neglect, or growing up with a parent who struggles with mental illness or substance dependence. Now, for a long time, I viewed these things in the way I was trained to view them, either as a social problem, refer to social services, or as a mental health problem, refer to mental health services. And then something happened to make me rethink my entire approach. When I finished my residency, I wanted to go someplace where I felt really needed, someplace where I could make a difference. So I came to work for California Pacific Medical Center, one of the best private hospitals in Northern California. And together, we opened a clinic in Bayview Hunters Point, one of the poorest, most underserved neighborhoods in San Francisco. Now, prior to that point, there had been only one pediatrician in all of Bayview to serve more than 10,000 children. So we hung a shingle and we were able to provide top quality care regardless of ability to pay. It was so cool. We targeted the typical health disparities: access to care, immunization rates, asthma hospitalization rates, and we hit all of our numbers. We felt very proud of ourselves. But then I started noticing a disturbing trend. A lot of kids were being referred to me for ADHD, or attention deficit hyperactivity disorder. But when I actually did a thorough history and physical, what I found was that for most of my patients, I couldn't make a diagnosis of ADHD. Most of the kids I was seeing had experienced such severe trauma that it felt like something else was going on. Somehow, I was missing something important. Now, before I did my residency, I did a master's degree in public health. And one of the things that they teach you in public health school is that if you're a doctor and you see 100 kids that all drink from the same well, and 98 of them develop diarrhea, you can go ahead and write that prescription for dose after dose after dose of antibiotics, or you can walk over and say, what the hell is in this well? So I began reading everything that I could get my hands on about how exposure to adversity affects the developing brains and bodies of children. And then one day, my colleague walked into my office and he said, Dr. Burke, have you seen this? In his hand was a copy of a research study called the Adverse Childhood Experiences Study. That day changed my clinical practice and ultimately my career. The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Anda at the CDC. And together, they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you know, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand better than we ever have before how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed.
Okay, so you as a parenting coordinator, becoming trauma aware is a step toward helping to heal, helping to have children change the trajectory of their future. And why is that? Because by having the awareness, you can address the issues, you can recognize the symptoms, you can teach and educate the adults who are around those children or that child on how and how incredibly negative the effects can be. You can educate them about how changing that trajectory can be incredibly positive. So becoming trauma aware, the ACE test and score that Dr. Burke-Harris was referencing originated as a study by the CDC, Center for Disease Control. Kaiser Permanente was one of the largest investigations of childhood abuse and neglect and household challenges and later life, health, and well-being outcomes. The original ACE study was conducted at Kaiser Permanente from 1995 to 1997 with 2 waves of data collection. The ACE scoring rubric is 1 to 10. And this is a slide that kind of shows just what Dr. Burke-Harris had kind of went over briefly. If a person before their 18th birthday has any of the 1 through 10 experiences in their life, then that person receives a score for each of those experiences. The average ACE score in America, as Dr. Burke-Harris had said, is 1. About 67% of the people in the US have 1 ACE score. If you have 1 ACE score, an interesting statistic is that you have an 87% chance of having 2 or more. And so the more ACEs you have, the greater the risk of chronic disease, mental illness, violence, and being a victim of violence that you will have in your future. You can find the ACE test online. One of the first sites that come up when you put in the ACE test is an NPR site. That one is particularly easy, an easy place to take the test. It's about 10 questions, as I said, and asking all before these types of experiences before your 18th birthday. And so I'm just going to read that to you to give you a little bit better of an understanding of what those questions are. So the first question is, before your 18th birthday, did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you? or act in a way that made you afraid that you might be physically hurt. The second question, before your 18th birthday, did a parent or other adult in the household often or very often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? 3, before your 18th birthday, did an adult or person at least 5 years older than you ever touch or fondle you, or have you touch their body in a sexual way, or attempt or actually have oral, anal, or vaginal intercourse with you? Question 4, before your 18th birthday, did you often or very often feel that no one in your family loved you or thought you were important or special, or your family didn't look out for each other, feel close to each other, or support each other? 5, before your 18th birthday, did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, had no one to protect you, or your parents were too drunk or high to take care of you or take you to the doctor if you needed to do so? Question 6, before your 18th birthday, was a biological parent ever lost to you through divorce, abandonment, or any other reason? Question 7, before your 18th birthday, was your mother or stepmother often or very often pushed, grabbed, slapped, or had something thrown at her, or sometimes, often, or very often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over at least a few minutes, or threatened with a gun or a knife? Question 8, before your 18th birthday, did you live with anyone who was a problem drinker or alcoholic or who used street drugs? Question 9, before your 18th birthday, was a household member depressed or mentally ill, or did a household member attempt suicide? And 10, the question is, before your 18th birthday, did a household member go to prison? So, 4 or more of these ACE scores for a person means that in the data, they have a 20-year shorter life expectancy. And that's just absolutely a shocking statistic based on the research that's been done. Early adversity affects health across a child's lifetime, mental health across that lifetime, education as well, of course, and we all see this as parenting coordinators, all of these, the mental health that children experience, the issues of mental health, and the education issues, we experience those all the time. Maybe what we haven't connected as often, maybe what you haven't connected as often, is the health across a lifetime, which for me was something that was really eye-opening. Development of the brain, a child from 0 to 18 years old, the brain development between 0 and 3 years old is just an incredible amount of development that will affect a child for the rest of their life. And children who are exposed to high conflict, to trauma, to any of these questions that indicate trauma, they are affected over a lifetime just from the age of 2 or 3 years old. Involvement in the court system across a lifetime. And this is something that is a very sad statistic that's very true, is that children who are exposed to these traumatic experiences have such a higher chance of being and having an involvement in the court system, whether it's dependency court or whether it is a criminal court or a juvenile court as a child. But it does have those effects as well. And of course, the ability to contribute to society as an adult later. So again, a 20-year life difference in expectancy of life is an incredible change for having 4 or more of these scores. It's just shocking and heartbreaking because it begins when a child, of course, is young and has no control over what is happening and what other people around them are doing. So why become trauma informed as a parenting coordinator? To protect the most vulnerable in our society, the children that we work with every day in our cases, to make a philosophical change to our society, meaning to bring this issue as a forefront issue so that teachers and doctors and lawyers and everyone, are religious communities, they are all involved in teaching and keeping it an issue that is bringing awareness to families and awareness to parents so that it can be addressed. To make a statement as to what we as a society hold precious and important. Again, what's important is our children. There is not, in a divorce case that we deal with all the time, paternity cases, of course, as well. But like in a divorce case, the financial issues are very important. We all know that. And people who are going through a divorce become high conflict or become very concerned and nervous because of financial issues, but nothing affects them quite the same way as the effects of what is going to happen with the children of that relationship. Becoming trauma informed to prevent disease and crime and incarceration. Becoming trauma informed to understand the needs of people who have experienced trauma and to solve problems. And that's kind of the whole reason that we're here as parenting coordinators, is to try to solve problems for families and try to facilitate helping them with their parenting plans, helping them with their parenting, but also helping so that the family and especially the children in the family can thrive and can have a positive outcome. The trajectory, the path and outcome. The trajectory is important because it is, again, a child who starts off in a high conflict dissolution of marriage case, where DCF is called on a regular basis and a dependency case might be brought. A child who has a parent who has a lot of mental health issues and then also substance abuse issues. That child moving on and having problems in school, not being able to handle their own emotional health because of it. That trajectory goes forward and propels this child into a situation that, if we can, as parenting coordinators at least, bring awareness and responsiveness to the situation and education and tools and ideas and additional professionals. If we can stop that trajectory, it can stop the trajectory of the child going forward into having future problems because of their lack of education or their issues in education, or because of the fact that they become then involved from their behavioral problems in the criminal system. So I encourage you to read a little bit more about trauma awareness and specifically about exactly that trajectory, how adverse childhood experiences at the bottom of our pyramid, the social and emotional and cognitive impairment that we've been talking about, how that builds to adopting. Oftentimes by children who experience this, they adopt health risk behaviors, and then disease and disability and social problems as a result. But with that trauma-informed intervention, we really can move toward a trajectory that is healing. So, trauma science concepts to really think about is that trauma is the root of crime, delinquency, domestic violence, and maltreatment, which often begins in early childhood. Trauma impacts the brain and body, and the effects are long-lasting, lifetime lasting. Trauma effects are intergenerational. That is, it makes sense that it's intergenerational. In your cases, in all of our cases, it may be that trauma that affected a grandmother was passed down to the mother in the case that you're dealing with, and is now affecting the child that is in the case that you're dealing with. Because the trauma that the grandmother experienced and the fact that it was not recognized, it wasn't in any way helped, it wasn't in any way given any type of awareness or education. and no one addressed it. There was no healing and no stopping that trajectory, and it was then experienced by the mother, who again now is passing that trauma and that negative experience down to the child. That could be alcoholism, it could be drug abuse, sexual abuse, physical abuse, or any combination. Just being aware, again, is our first step, and it's the first step for the family as well. Addressing it as an issue to solve and work on to change the trajectory for that child or those children. So the next step after the education part and being able to easily recognize and understand the science that is trauma awareness, the next step is trauma responsiveness. And that's a key and important part to learning about this area of science, social science, and to adding to your practice as a parenting coordinator and adding to your responsiveness and helpfulness to these families. So therapeutic justice is the court system that you are in when you are working as a parenting coordinator. According to the Florida Supreme Court's May 3rd, 2001 opinion, the court's role is to craft solutions that are appropriate for long-term stability and that minimize the need for subsequent court action. So those types of courts are drug courts, domestic violence court, dependency court, delinquency court, mental health, veterans court, and of course, dissolution of marriage court. And the court the Supreme Court is very much encouraging that the system have solutions so that we can have long-term stability. And that is part of your job as a parenting coordinator. So the Supreme Court has, as I said, been very much a champion of becoming trauma aware and responsive. And Justice Pariente, who was a Supreme Court justice and also the Chief Justice for a time, was very much aware of it.
I would like all judges to know or to take the time to learn about the science of trauma and child development, to understand the adverse child experiences, what that means for the families that are in front of them, look at it through a trauma lens, and make sure that every decision that they make is properly informed.
So the judge in your case is trauma educated, and that's important because you can rely upon the fact that the court will at least recognize and understand the issues that you're raising as a parenting coordinator in the case. The court is really where you receive your authority, obviously, as a parenting coordinator when you are appointed. And so knowing how important this topic is of trauma responsiveness to our court system and to our justices and to our judges is important for you to understand as well. Policy of the court mandated, and the idea is that the first time a family is before the court is hopefully the last time that a family is before the court. Sadly, we don't see that often, especially as a parenting coordinator, because we're working with the higher conflict persons who are in the court system. But it is mandated by the Supreme Court. 40% of all cases, by the way, and it's kind of an interesting statistic as well, but 40% of cases that come into the court system are family law related. 60% is everything else. So it's a large percentage of cases, and that's why judges and the court system has become so interested and has become trauma informed and responsive, because it deals with the largest percentage of the cases that they see every day. Of course, always something that is a good point for the system and just generally is that it saves resources and court time, saves money. To get it right at the beginning and to be able to be aware and then move to responsiveness so that you can get it right. So the court system also put together something, the Supreme Court did, that is a toolkit in regard to this topic for trauma and child development. And that toolkit, which is, I encourage you to go and look to, it is really informative. It has great ideas. It's a way for you to start thinking within your parenting coordination practice how you can use trauma awareness and what you can do to make changes. And that's really what the rest of this presentation is about, is how do you go about doing that in your practice. So those transformative types of court practices really translate very well to the practice as a parenting coordinator. And the toolkit for your profession, the Supreme Court encourages different professions to make that toolkit. And that's what I'm suggesting to you, is that you should make one, developing your educational materials. They can be some of the information that you've seen here, the ACE test, for instance, information about it, information about the study that was done. You can have the TED Talk, from Dr. Burke Harris. And there's just a lot of information out there that you can find and have materials that would be available for the parents, for the other family members, collateral witnesses, as we sometimes call them, but really the grandparents and family members and neighbors and friends, teachers. Teachers are also given a curriculum in regard to trauma awareness and trauma responsiveness. A lot of professions now are moving toward that. But not everybody has received that information. So if you have those educational materials, it can be given and shared with everyone in the case. For parenting coordination, make sure you and your staff are trauma informed by education and discussion. It's really important how our staff, how our first person, whether it's a receptionist or a secretary, for me, it's possibly a paralegal, that all of them have the same type of education that we're going over right now. It doesn't have to be, super in depth, but it can be something that is at least the ability to be aware and to be able to spot these types of issues. Use the ideas and tools and the handouts to guide your practice and your decision-making in your case. And it really does, in getting into these areas of education on trauma, on toxic stress, on, adverse childhood experiences, it really does make a difference in your decision-making and what you do in your practice. Change your own behavior. I know I do. And try to regularly to check in, to change behavior, language, and patience level. And boy, that is a difficult thing to do in the job that we have as parenting coordinators sometimes, of course, because we're dealing with such high conflict people, people who, regularly behave in that extremely high conflict manner. And yet we have to, and we do have to check ourselves to continue our level of patience. All righty. So Big 10 that the court talks about, and again, I think it is important for your practice, is understanding the science of trauma and child development, presuming that trauma is probably in the case. One of the ACE questions is if, you've been through a divorce. And so just by the fact of the types of cases that we are appointed in, we have to presume trauma is present. Coordinate all cases involving one family. If there is, dependency cases and domestic violence cases and family law dissolution case. Trying to be, you'll see a little bit later in number 8, being a convener, but coordinating is important. Set an expectation for trauma and child development in information so that, again, it's expected that as part of your services as parenting coordinator, these participants are going to have education on it. Read the case, read your case with a lens that trauma is present, and with a trauma lens, meaning what you are currently doing and how you're currently speaking or what you're doing in your office could affect the child or could affect the parents because of the trauma they have suffered. orders screening and assessment and treatment. It's really recommending, of course. The court system orders it, but we recommend that screening and assessment and treatment occur. Hold all the participants, the attorneys, the court system, hold the judge, accountable for the fact that they need to understand that trauma, in your case, might be something that is really affecting everyone, and the ability to both, either stop having enforcements or to come to an agreement, or to just simply let children live in a way that is peaceful. You got to hold everybody accountable for that, the parents, the attorneys, and also the court. Being a convener, I think that's one of the most important things. In one of my cases that I've been on recently, it involves a lot of behavioral issues. And so all the children in the case have a therapist. The parents both each have a therapist. There's a reunification therapist as well involved. And with all of those people, with all those working parts, we have regular bi-weekly meetings where, as parenting coordinator, we convene and meet by Zoom and do our best to make it so that we can all be there to share what's been happening. And I can tell you that it has been, extremely helpful in trying to resolve some of the issues, and because we're all on the same page and we're all hearing the same information and we're all asking each other for help, which of course is, one of the most important things to actually being successful in helping a family. So I encourage a lot of acting as a convener, and I find that it is the most successful tool in the toolkit for a parenting coordinator in trying to help with trauma responsiveness. And then, of course, monitoring your data on all of this, and seeing how successful these types of actions are in your practice and how helpful they are to the families. Always take care of yourself. Of course, we deal with people who are, again, such high conflict that that's an important thing. You can't be patient, and you cannot be as helpful when you are under a lot of stress because of how stressful these people's lives are. So definitely taking care of yourself so that you can be that helpful person. Okay, so trauma, transformative practices, learn the science of trauma and child development, read, listen, utilize resources, and facilitate learning opportunities to further understand the impact of early childhood adversity on the children and on the adults. Whether you are an attorney, mental health provider, or mediator, as a parenting coordinator, you need to take the time to learn that science and child development. We may believe that since we know the law, for instance, in family law as an attorney, or we are skilled as a mental health provider or mediator, that we don't need to be an expert in child development and trauma science specifically. But to really make an impact in your case and provide the best service as a parenting coordinator, you really do need to take the time to engage in that kind of continuing education in these areas. Okay. Inside and out. So we've been talking about how you can change and be responsive in your practice. And so a good way to start is just to look at, your office, entering your office, the appearance of your office. Staff, as we just briefly kind of went over, staff have to have the education and the same type of training, even if it's just briefly, so that they have the ability to be aware and they have the understanding of how, to most effectively deal with people who are high conflict in order to bring down a situation instead of to sort of inflame a situation. That's not an easy skill, and it's not something that comes intuitively to absolutely everybody. And so sitting down and talking to your staff about it just makes a lot of sense. It's also nice because it helps them, because they're dealing with people who are very high conflict for you. And so trying to check in with them, to give them tools and resources is another super important part of what we can do. So the appearance of your office, as I was saying, education materials being available in your waiting area, in the conference room on the table while they're waiting for you to go and, copy some things. Having things that are available everywhere to look at, to briefly just see photographs of, families that are happy and smiling and positive, even though they are in situations that look as though they're meeting with either counselors or attorneys or perhaps, just pictures of smiling faces of children is also very helpful, I find. But the education materials being available so that they can take a glance at it, and also education materials that they can take with them. Websites to go to, just as much information as you can gather with an office that appears to be welcoming and peaceful, so that they're able to, feel that confidence from you as the parenting coordinator. In your waiting area, communications during your sessions, of course, trying to build trust. That's one of our biggest goals, is to try to build trust. And how do you do that? By providing a consistently calm and consistently understanding environment, and asking questions and listening. Allaying their fears is a good way to start building trust and being trauma responsive. Again, being patient, calm, presence, very important, supportive and understanding, and mindful of a client's time. I think that's a pretty important point as well. Sometimes, in a parenting coordination session, when the two people, perhaps they're by Zoom, or perhaps they're in separate rooms and you're going back and forth between the rooms, and it's taking a really long time with one person, keep mindful of that, keep mindful and try to perhaps either stop then for a moment and say, to the one person of the relationship who might need a little bit more time to talk with you, hey, let me just stop this for a moment. I'm going to go and talk to the other side for a few minutes. And then you can tell the other person, hey, it's taking a little longer today, so why don't we reconvene? I don't want to waste your time. And I'm going to go and concentrate with the other parent right now, and we can reschedule right now, or schedule again for the rest of the session right now, because you do want to be mindful of people's time just sitting and waiting for you. And so not re-traumatizing children in the case, that is so important. As a guardian ad litem, we often go and speak with the children. As a parenting coordinator, a little less so. I do speak with children as a parenting coordinator, and I know that you all out there do too. But we do have to be super mindful when we're doing that, because some of these children have had to speak with so many different professionals, and each time they do, it's sort of solidifying the things that we're trying to actually solve, which is exposure to the litigation and to the court system and to the adult issues. Sometimes it can be cathartic and it's a good thing. A lot of the time it can just be re-traumatizing. Keeping that evaluation process in your assessment as the parenting coordinator to determine what you're going to do next is important. Should you be meeting? Where are you going to be doing that, and how? Can you do it at a park? Can you do it someplace that's a little less, at a McDonald's, at someplace where it's a little less of a stressful situation, and a little bit more of just kind of sitting and talking to a child, building the trust with that child. I never, in guardian cases or in parenting coordination, just meet first with a child and start talking to them about things or issues that I'm trying to get information on. The first time I meet with a child is always just to simply have them show me their room or show me their homework and artwork, if they come to my office, or if we're at a park, to just walk around and watch them play on the swings a little bit and ask them a little bit about school and their friends, just to build trust. be very mindful of victims of violence intimidated by the perpetrators, or victims of great intimidation. There may not be a domestic violence injunction in your case, but there may be extreme intimidation that's going on. And in awareness of that, trying to minimize that type of trauma is important for us to do as parenting coordinators in our own offices and in our meetings and sessions. Okay. So making it a positive, supportive, and safe experience. That's what it's all about. Educate, educate, educate. Parents, clients, again, family members. Sometimes educating the grandparents on these issues is really important, or siblings, because of the siblings of the parents, because they may be contributing to some of the trauma that occurs. To collateral witnesses, to your staff, teachers, doctors, to everyone who you come in contact with as the parenting coordinator to talk to about the case. Educate on trauma. Talk about it, make it a well-known fact, and lead to societal change on this issue. Accentuating the healing experience. I love this particular slide because I love that the court system in its therapeutic justice has, in particular, the dogs available in the courthouse to help witnesses, to help children, helps a lot in criminal cases too, but definitely in dependency court and in family law court, to have the companion dogs available. What a great effort that has been on the court system, putting it forward. And those are the types of things, that innovative ideas like that, to try to innovate into your practice as a parenting coordinator. Do what you can to make the environment just so much more welcoming and so much more healing for your clients. In your parenting coordination practice, constructing the parenting plans, helping, when you're either trying to help with a modification or with an initial parenting plan, doing that, looking at it with a trauma lens, will change, all of the specifics that go into that plan. Recommending social services to address the trauma, whether that is through, therapy, through help at school for the children, at doctor's appointments, recommending social services that are out there to address issues, address a parent's ability to parent. That's something that you can be very honest in a supportive way, but you can be very honest about it. Addressing a parent's ability to parent if they have alcohol or drug issues or mental health issues. Recommending therapy for children and participation and facilitation by parents, being that convener and making sure that it occurs and that it's moving forward. Recommend parents to partner with the child's schools, with teachers, so they can help and be involved in education. But it needs to be a convening and proactive partnership in every realm that we as parenting coordinators touch. Be innovative and be proactive. I have the same slide up again because I think it's really important. Going to, a site to take the test for yourself. Just you don't share it with anyone. You just take it for yourself and reflecting on that and how any of the adverse childhood experiences might have affected you. And then a really important thing I like to do is to add it to something that the parents do as part of their experience with me as a parenting coordinator, asking them, and again, it's a personal thing. So asking them to do it and asking them if they would individually, each of them, after taking the test, if they would share with you, or if they want to share, invite them to do so. To share how their experiences as a child might be affecting their own children's experiences and their own children's lives. And so just, parents love their children and they get lost in a lot of things that life throws at them. And so just being back to a point where the parents start to consider the awareness of what is happening in their own life and what has happened to them in their lives and how that could be affecting their children can be transforming for families. So interesting points that Dr. Burke-Harris had made. ACEs, childhood trauma, is the greatest unaddressed public health threat to our country today. And I think that's really interesting because, raising the issue of, for instance, the current opioid crisis that we've been dealing with, to the campaign that we've had successfully for so many years against tobacco. Change came because change and transformation came because it became a household word. The campaign against tobacco was marketed and advertised and talked about in schools and talked about everywhere. It became a household word and understanding. The current opioid crisis is doing that now and transforming what will occur because of it, because of this information, the marketing of it, the advertisement of it to society as a whole, so that we all recognize it as an issue. The same thing with childhood trauma, so that it becomes a household word, so that people in society are talking about it, so that we all know what the causes are, and we all know how negative it is to have these childhood adverse experiences, so that we can make changes. And I think that will be the case because it is so successful. Educating people in general on a topic always leads to transformation and success. So holding all accountable, we talked about that just a little bit briefly earlier, and holding everyone in the system who is part of this family accountable is an important part of what we can do. Parents, and we've talked about that in several ways, accountable for respecting the trauma experienced by the children in their home. Holding batterers accountable, people who are violent either towards each other or towards each other with children present or towards children. Holding the court accountable for maintaining, a level of behavior and a level of recognizing what these issues are and how important they are. Holding attorneys accountable for considering what trauma is and reducing it instead of contributing to it, becoming more high conflict or making the situation more high conflict. It should be that we, as the parenting coordinator, raise the issue. I don't mean confrontationally, I mean just raising the issue that everyone could be a lot more aware of the fact that the high conflict that's occurring in the litigation is not helping at all for the children in the case. If you have children in your case that are delinquent youths that are having behavioral issues, holding them accountable for participating and becoming aware through counseling and through services at school. Holding child welfare investigators, if it's DCF that's been involved, accountable for just working hard on the case and being informed and understanding the parents and the children's trauma histories. Case managers on the case accountable for seeking, trauma-informed treatments for the families. And therapists accountable for using evidence-based treatment to really affect and change. Reunification as an example is a very large area of cases that I have in my practices. And it's really difficult with reunification cases. it can slow to a complete stall sometimes with reunification cases. And we want to hold everybody, the attorneys, the therapists, everyone, yourself as the parenting coordinator, accountable to be moving this case along, moving it along as best we can to try to attain healing and supportive responses in the case of reunification therapy to obtain and attain the reunification as best we can. Transformative practices, as we said, is being a convener, bringing community partners together in addition to our own particular cases that we have, where we have to bring the therapists and the attorneys and all of those participating together to talk about how we can best address what the children are experiencing in the case and how we can best address the parents and their behaviors and their language and how they speak. Doing that with a case, with a particular family is the most important part of our job, but also bringing community partners together to be addressing trauma and advocating for treatment. Trauma issues are complex and require multiple systems to work together. You know, we have the mental health system and the court system. Just those two things alone have so many moving and working parts to be able to coordinate. So bringing those partners together to talk about how we can make our systems more successful for trauma responsiveness. Judges have influence and authority in our system. Having, you know, regular types of community partnership that include judges in those partnership meetings would be an incredibly great resource as a parenting coordinator. It also kind of gives a lens to those judges, how and what you do in your practice, why it's important, and the types of things that the court can do that would be helpful to help you in your practice. Remember that every profession has authority and influence, and especially in parenting coordination. Monitor data, reviewing and analyzing what you learn from the ways that you change your practice, the policies you have, the types of education that you're giving out. Stop every now and then just to review and analyze, how is it working? Is it working? And adjust your practice based on what you find. And a great thing to do is sharing with other parenting coordinators what they do, how they do it, topics that are interesting and hot and on the front of what we do every day. Coordinating together so that we can share that together is very, very important. So I encourage you to do it. Harnessing Hope is, you know, really brainstorming to make that toolkit for your work, for parenting coordination. Having more communication between, as we said, professionals, sharing those innovations and ideas, contributing to your own talents to communicate and make every community trauma informed. You know, volunteering to talk about your practice as a parenting coordinator, what it means, so that communities know that it's out there and it exists as part of the family law system. Most people don't know that. Most people know about guardians ad litem. They think they do at least know what that means. They know what attorneys do, and they know about divorces and paternity cases in the system, about extended family adoptions. They know about all of those things a little bit, but they don't hear a lot about parenting coordination, and they should. And so contributing, you going out and doing that, giving yourself, like this talk, but doing it perhaps to communities that don't really know much about parenting coordination or about how it fits into the court system and why it's so important and what it can do to help people and what it can do to help children and families that are experiencing, high conflict. those are transformative practices. Just act and make this an issue so that we can together as a community of parenting coordinators make the topic of trauma and childhood toxic stress, adverse childhood experiences, to make that a household name and topic, and to be able to express and show to our communities how being responsive to that, acting on it, is going to make a difference in families' lives and in children's lives. So it has been a pleasure to chat with you today. And I encourage you at this point, if we were in person and not by Zoom, I'd be able to ask questions. We have plenty of time for that. But you are more than welcome to contact me just to discuss these types of topics, to talk about what might be happening in your community. I'm always interested. So thank you so much. And it was a pleasure being here. Have a good evening. Take care.